burnout? Burnout is a stress-induced occupational-related syndrome, and it has characteristic features. Firstly, emotional exhaustion. Secondly, a feeling of cynicism or depersonalization. And thirdly, a loss of purpose and meaning in work, or low personal accomplishment. The condition is actually listed in the ICD-10 under the category of problems related to life management difficulty. And the key point is that this can occur at all stages of training and career and develops over time. So none of us are immune from this. It can happen early on, it can happen late, and I think this is one of the most sinister issues with regards to the significance of burnout. Importantly, this is recognized now as an issue that is amongst healthcare professionals across the board, across specialities, whether one is at the front line as a clinician or working in the labs as a scientist. And this has been noticed for several decades, but has really come to the forefront in the last few years, given the increasing significance and prevalence of this condition. So risk factors. I'm going to focus on risk factors for burnout in the oncology profession, but as you'll see, there are many factors that are applicable to other disciplines, and within oncology or cancer professionals, this is applicable to not only oncologists, but other healthcare professionals, oncology nurses, allied healthcare professionals, and also scientists. So we must remember that oncology is a rewarding profession, but caring for patients with cancer can also be demanding and stressful. So there are a number of potential factors. We constantly face patient life and death decisions delivering bad news. Our therapies can be toxic, and we're supervising these therapies where often there is a limited ability to prolong life substantially for many patients. By virtue of our profession, we need to keep at the forefront of rapid scientific and treatment advances, and we need to balance patient care as well as education and research. Taken together with increased workload, administrative requirements, and medical legal issues, reduced resources and reduced autonomy. There are a number of individual and organizational factors we need to consider as well. Many of us are a type A personality where we keep our life on hold for our career. Work-life balance, well, we're not very good at that, many of us. For example, taking vacation or taking work home. Country of practice is also references, as well as healthcare differences. Social isolation and not having a support outlet. Let's look at some of the potential consequences of burnout. Well, there can be a negative impact on the quality of care, which is clearly one of the most important aspects here, given our profession. Increased medical errors leading to litigation. People leaving the profession too early, taking early retirement, or indeed changing profession completely. And of course, substance abuse, depression, and suicide. Altogether, reduced patient satisfaction and impaired professionalism. I'd like to highlight some excellent work pioneering the field coming from US oncologists. So this is some of the results from an ASCO survey. And many of these publications are in Journal of Clinical Oncology, as you will see. So first of all, looking at burnout and career satisfaction, 45% or so of US oncologists were classified as burnt out, and the hours per week devoted to direct patient care predicted burnout. Of interest, in this group of oncologists in this initial survey, of over 1,000 oncologists, only 63 were under the age of 40. Then there was a survey looking at oncology fellow career plans, and interestingly, fellows' expectations regarding future work hours were 5 to 6 hours per week fewer than oncologists actually reported their work hours. And then looking at satisfaction with work-life balance as well as career and retirement plans, over 25% reported a moderate or higher likelihood of reducing their clinical work hours in the next year, and over 30% indicated a moderate or higher likelihood of leaving their current position within 2 years. And around a third plan to retire before the age of 65 years. Now moving on to the next slide, which highlights the ESMO Professional Burnout in European Young Oncologists Survey. This focused on under 40-year-olds. So within the survey, we had 595 oncologists that were under the age of 40. Of note, the highest number of participants were from the UK, but there was a large number of participants across Europe, as indicated here in this map of where the oncologists contributed. So this could only be done through working together across Europe and other countries, and this was led and developed by the Young Oncology Group of ESMO. We presented this as an oral presentation at ESMO in 2014, and the publication was in Annals of Oncology a few years later. So what we saw was that in multivariate linear regression analysis, there are a number of significant factors. Geographical region, and this was for the first time that we could see that actually geography and which countries and areas that oncologists were working in influenced burnout. Other factors were no access to support services, no good work-life balance, living alone, or having no adequate vacation time. So looking now at the map, you can see the rates of burnout according to using the MASLAC burnout inventory. So what you see here is the highest rates of burnout in southeastern Europe and the lowest rates in northern Europe and the British Isles. But when I say lowest rates, over 50% of oncologists responding felt that they were burnt out. And what I wanted to show you is that the immense coverage at the time, back in 2014, when this was presented at ESMO, and I was really, really pleased, and ESMO as a society are really pleased that there was recognition of not only the amazing drugs and new progress in patient treatments, but also what oncologists are facing, of oncologists who will be already leading patient care, but also younger generations who will be our future leaders. There are over 600 publications on burnout in oncology across oncologists, surgeons, nurses, for example. I'm not going to go through all these publications, but it's really to highlight to you the wealth of work in this area, given the recognition of how important it is to our workforce and ultimately patient care. I'd like to highlight some of the work from the Society of Gynae Oncologists in the US because they really have, like ASCO, done a lot of work in this area, specifically in the speciality of gynae oncologists. And they also have published evidence-based review and also recommendations for burnout. So I found this article, which I thought was very interesting to highlight, and it's really looking at the impact of physician burnout on clinical and academic productivity. This was focused on gynecological oncologists, but this could be applied across the board, and I think it's showing us a couple of things here. In this report, there was a disproportionate rate of burnout among females in gynae oncologists, but using a number of analyses outlined in this paper, it did show that over a 15-year period, they would expect fewer publications in the order of 15% or so due to burnout. So food for thought. So I'd like to focus on this stress response curve. Now, as you see, this is from 1979, but I think very, very relevant. I'm sure we can all relate to where we may be feeling on this curve. Now, often it can be a good stress, if you like, in terms of stimulating us to perform well, but there's a limit where stress can become negative and cause distress and lead to exhaustion, ill health, and ultimately breakdown. So from my point of view, I know there are points from personal perspective where I'm on various aspects of that curve, and I very much hope to avoid being on the downhill curve of that graph there. So let's talk on to what we're all really wanting to know the answers to. How can we prevent burnout? Well, there's been some excellent publications from Tate Shannonfeld's group regarding measures to prevent burnout. The key message is that, no surprise, just like oncology treatments, there's not one solution. There is no one-size-fits-all approach here. But there are multiple strategies and tools that need to be suited not only to the individual, but organizations and country. I think it's really important to acknowledge that burnout is not irreversible. it should be considered as a continuum, and there's a complex interplay with engagement, stress and depression, and those forces for individuals can change, and it's about really realigning that balance. So, what about resilience? What is psychological resilience? Well, it's the ability to bounce back from tough times or even triumph in the face of adversity, to develop tenacity, but not at the expense of reason. It's no surprise that higher rates of burnout have been associated with lower resilience in doctors. An underlying predisposition that some people may have, it could be a personality characteristic that makes one more resilient to difficult or challenging situations. We all know people, maybe ourselves, that can really tackle difficult or challenging situations. But there is growing evidence now that this can also be learned and developed. It's a skill that can be learned, and that's what we need to focus on. So developing resilience, so this is a really important aspect and really being recognized across countries, across organizations. I show you here just an excerpt from the General Medical Council that doctors under pressure need resilience, not mental toughness. Resilience training is already very popular, being used in corporate environments, and it's about applying that to the medical field. Individual institutions may have their own approach, but it can be rather inconsistent and often voluntary to take part in, and whether people have seen the communications really about whether time and management will allow this. One potential approach that has been suggested is resilience skills training courses for professional health groups, for example, oncology healthcare groups. So I'd like to urge you to read this article in The Lancet, and this really covers the interplay that I was talking about between burnout and engagement. And we need to consider all the factors that I'm not going to go through in this presentation, how we can tackle burnout. But what I'd like to show you is that in this study, overall burnout decreased by 10%, and that was deemed significant, by employing both individual-focused and structural organizational strategies that can really result in clinically meaningful reductions in burnout among physicians. And what you'll see here in this diagram is multiple aspects, both individual work unit factors, organizational, but also national factors. And I urge you to have a look at this diagram and publication. Here are a number of other publications, reviews that I've directly been involved in with regards to controversies around burnout in oncologists and how we can try and tackle this altogether. So, for example, the ASCO educational book last year and a number of other publications in Cancer Treatment Reviews and Nature Reviews Clinical Oncology. This is a real area of research as well as debate and controversy, and we need to work together as organisations and individuals about how to tackle this.